Welcome, Jen. I do want to thank Valneva Canada for sponsoring this webinar, providing an education grant to bring this to you today.
Awesome. Thanks so much, Kathy. I'm just going to come in and share my screen here, if that's okay. Welcome, everyone, today to our session on vaccines to vital advice, travel consults, and pharmacy. Today, we're going to be going over some ways in which you can integrate travel medicine holistically and sort of seamlessly into your practices and some of the opportunities to do so. Before we get going, I'll just go through my disclosures. I'm Jen. I work for the Ontario Pharmacists Association, but I do have relationships with some commercial interests, notably Pfizer, GSK, Valneva, Moderna, Sanofi, Bavarian Nordic, L'Oreal, on their advisory boards or speakers bureau. I am participating in a research initiative with Pfizer unrelated to travel medicine, and I have not received a speaker's fee for this learning activity as I am an employee of OPA. And the program itself has received financial support from Valneva. So thank you very much, Valneva, for that unrestricted educational grant where there's been no input into the program, but just support for the development and delivery of the materials. So before we go into the material itself and the learning objectives, Kathy has a poll for us today, just in terms of what your comfort level is in relation to delivering travel services. So you'll see that pop up on your screen. So out of a rating of 0 to 5, 0 being the least confident, 5 being the most confident, how confident are you in counseling and assessing for travel health needs? So I'll just give it a few moments for you to enter your information into the poll. I'll go through the learning objectives for the session while you're voting, and then we'll take a peek to see how everyone's feeling to start the session. So by the end of the session today, ideally, you should be able to identify and communicate opportunities to optimize vaccination in the context of upcoming travel for your patients, to access current accurate information on vaccine and medication recommendations for global travel destinations, and integrate our new scope of practice opportunities into travel health conversations with your patients. So Kathy, maybe if we can end the poll. Let's see
Mm-hmm.
how people are feeling. All right, so we have a varying level of confidence here. No one's actually feeling super confident with a number 5. And, I think that that may be a result too of just how much things have changed in the last little while. I mean, travel patterns, disease patterns, vaccine availability, new antigens. There's been a lot of change over the last 5, 10 years. And that may be impacting people's confidence. But hopefully, after today, you might feel a little bit more confident. Any of you that are in that 0 might move up to a 1 or a 2. But it's great to see that everyone's here and interested in travel, despite maybe not feeling like you've got it fully mastered just yet. All right. So why are we here today? I know that, for many of us, we've talked about travel health a lot in the last decade, because it was 2015 when Ontario pharmacists got that scope of practice to be able to administer some travel vaccines independently within our own scope. So with that, we sort of saw a burst of education, interest in providing travel services. But ultimately, the amount of travel health service being provided in pharmacies really varies across the spectrum. Now, right, we have kind of the perfect storm. So the travel health landscape is evolving quite rapidly. There was obviously a global pandemic that drastically affected global travel patterns in 2020. And we saw that with the data that, international arrivals, departures dropped significantly for many reasons, with shutdowns, the requirement to do things like PCR testing prior to travel, and obviously concerns around being in some of these spaces accessing foreign healthcare environments. Now, with the reopening of the world, so to speak, and despite the fact that COVID, of course, is obviously still present and impacting health systems globally, there's sort of this attitude that COVID is over. And with that, a lot of people are, starting to travel again. But the types of travel that they're doing is somewhat different. We see a lot of people doing more, adventure, outdoor, rural type travel, more bucket list type trips, and so forth. So different travel patterns to consider as we think about the risks associated. And in terms of how people are accessing their healthcare, pharmacies are, of course, one of our most accessible destinations. We have a lot of the products in our front shop that people will need to put in their suitcase or in their travel kits to ensure that they're traveling safely and healthily. And of course, if they do have chronic conditions and have medications that manage them, we often hear people asking about vacation supplies and traveling with medications. So naturally, we are a bit of that destination, as well as advertising that we do vaccines. More and more patients are thinking pharmacy when they're thinking travel health. Additionally, as you may have seen, there's the consultation going on right now where the government has instructed the college to propose draft regulations around the new scope of practice for pharmacists and pharmacy technicians, which will include the inclusion of more publicly funded vaccines in the vaccine program in our ability to vaccinate, as well as the opportunity for pharmacy technicians to provide a greater list of injectable products like vaccines. So this is going to be great news because people are going to be talking about it. And there's that opportunity to take the travel conversation to look at vaccination history and vaccination optimization more holistically. So we'll talk a lot about those conversation starters and these opportunities to, sort of link travel to routine immunization throughout the program today. So first off, we can't provide travel services if we don't have someone to provide them to. And if you don't have a full-fledged quote unquote travel clinic located within your pharmacy, how do you sort of, bridge that gap in identifying someone who might need some travel advice and start that conversation, whether it's yourself, your pharmacy team, or that opportunity to use your environment to promote the opportunity to have those sorts of conversations. So we talk about perhaps identifying the hidden traveler. So despite not being able to necessarily provide all travel services in your pharmacy, if you're not a fully fledged clinic or yellow fever center, a lot of patients will benefit from having some of your knowledge conveyed and that determination of whether or not they actually need to talk to somebody who may be a little bit more advanced in terms of what they can provide on the travel side. So one of the opportunities that we could all incorporate into our practice would be to ask about upcoming travel during medication reviews. So if you're doing a meds check, as we're thinking about an annual or a follow-up, just asking, when we're talking about your medications, do you have any upcoming travel plans? Do you need to consider medication supplies or how you're traveling with your medication? And is that vaccination history up to date? So discussing that immunization status and the needs when they request vacation supplies is also an opportunity, once again, to talk about doing a service like a medication review to ensure that we're getting people off with everything that they need, but to consider that perhaps maybe there are some immunizations, travel, or routine that they would need in order to stay healthy while away. Promoting, of course, any sort of travel health services or advice that the pharmacy is able to provide in any sort of signage. If we're thinking about sort of winter as being a travel season, snowbirds going away, people going to warmer destinations, travel over the holidays, there's an opportunity, if you do regular mailings, email communications out to your patients, to include a piece around preparing for travel and thinking about immunization, as well as within the pharmacy's social media. So just including that within things like social media marketing, calendars, and so forth. And of course, as we're talking to our patients, listening and watching for clues in the over-the-counter aisles. So if somebody's in the sunscreen aisle, searching for products at, any time of year, but especially, perhaps going into fall and winter, insect repellent, some of that GI area when we're thinking about preventing, treating travelers' diarrhea, motion sickness, and so forth. So that opportunity when somebody mentions perhaps that they're looking for a travel size this, asking if there's upcoming travel and if they have any sort of additional needs that you could assist with. As we go through the presentation, I have a couple of sort of case studies to talk about the different sort of levels of traveler and where you might be able to provide some services, where you might want to consider referring. And I'm a little bit, I always go for the entertainment where possible. As of this fall, right now, we've just gone into the NFL football season. I am a fan, and we're going to go with the 2025 Unhinged NFL edition in our case studies. All of this is purely for entertainment value, does not actually refer back to the people mentioned, but just trying to inject a little humor in the day because we can all use a little bit of levity in our lives. So we'll start with patient BO, aka Bad Bunny. This is a 31-year-old male who's in your pharmacy, no chronic medical conditions, but he's moving to Ontario from the United States, and he's asking about whether or not he can get his flu shot at your pharmacy. He mentions, while he's there, that despite moving to Canada, he's going to have to go back to the US. He has a work trip in February of 2026 to Southern California. So when we think about this patient and talking to him about, perhaps, making your pharmacy his destination, even though he doesn't have chronic medications, there are services that he could get while here. Thinking about the fact that he probably isn't going to get a family doctor right away. Moving to Ontario, we've got 20% of our population right now who doesn't have a primary care provider. Talking about things like, minor ailment services, how to navigate the healthcare system, what that, immunization looks like. This would be a perfect opportunity to identify him as sort of a hidden traveler here, in the sense of considering how you might be his entry point into the healthcare system and travel health services. So with the work trip to Southern California, we think about U.S. travel, and while generally perceived not to be a significant health risk, we do need to think about some of the changes in epidemiology, what we're seeing in terms of infectious disease, and what kind of precautions we'd want to advise before that sort of travel. In Southern California, we're actually seeing more of the Aedes mosquito that transmits some of the viral illnesses like dengue, chikungunya. And while, in the area that he's mentioning, we don't necessarily see those diseases because of mosquito control, it is important to be aware that in areas, where previously we haven't had disease exposure, those patterns do change, and keeping up to date to provide that sort of advice is really important. As well here, right, we're going to take this opportunity to ask him if he's been fully immunized with a routine immunization schedule, and looking at that opportunity now in pharmacy to perhaps do any sort of catch up or booster doses that are done. So with that, patient's very grateful because he came in just asking about one thing, but got a lot of information that he's going to need in terms of how to navigate, and now views the pharmacy as a sort of, first destination, probably the people that are going to help him the most, now and into the future, especially if he isn't rostered to a primary care provider. So while this doesn't necessarily seem like a travel opportunity at first, definitely with that opportunity to talk about, going to the United States, perhaps even some of the, outbreak issues we have, asking about whether or not he's aware, if he has that second dose of measles vaccine, so forth. Talking about, the seasonal vaccines, ensuring he gets that flu shot and has access to the things that he needs, as well as perhaps some of those OTC medications to travel with, given that it's a work trip, and ensuring that he's fully good to perform that Super Bowl halftime show. So thinking about that case, right? We have a very low risk patient, no chronic health conditions, young, healthy, going to what seems like a fairly low risk destination. One of the best things that we can do as a practitioner when we're considering what type of travel service we can offer is really understanding how to stratify risk in this context. So when we think about risk in terms of travel health, there's intrinsic risk. So the sort of that risk of the patient themselves. Are they healthy? Are they immune compromised? What's their age? What are some of those other health factors that would make them at higher risk of infectious disease, or becoming ill, having some sort of incident while they're abroad? So that intrinsic risk within the patient themselves, which as pharmacy professionals, we know very well because as we're taking care of patients, we know their complement of health conditions, their medications, and so forth. As well as the extrinsic risk. So, what's the risk of their travel plan? What's the risk of the destination or destinations they're going to? What type of diseases are transmitted there? What type of vaccine requirements, and so forth. So, really, when we're stratifying risk, there's a blend. It's not just the destination itself that's the risk, but sometimes the patient themselves being more complicated. So, when we're thinking about the types of cases that you might be able to address in pharmacy, for some, it may just be, low, medium risk patients with low risk destinations. Being able to provide some of that advice, being able to provide vaccination where appropriate, recommend OTC medications, perhaps, make recommendations to providers for some prescription medications for things like, travelers, diarrhea treatment, should it happen, so forth. Perhaps that's really all you're comfortable in dealing with, and that is totally fine. And in having those conversations, once you identify a risk factor that puts someone sort of out of your risk threshold, that ability to refer out and send them in the direction of someone that can help them with that higher risk threshold, whether it be their individual risk or the extrinsic risk that we talk about. So really, that pyramid is, for the most part, you're going to see a lot, and we see a lot of people either, patients without current travel plans, where just optimizing immunization status and health optimization for life in Ontario, those low, medium risk patients with low risk destinations. We get into then maybe our low or medium risk patients and then medium risk destinations. When we think about medium risk, maybe that's, that there's some mosquito transmitted illness in the destination. We think about perhaps more complicated itineraries, some of the more, adventure seeking activities. And then we get into more your medium high risk patients or low medium high risk patients, but the medium and high risk destinations. So those oftentimes would be things like your yellow fever destinations, area with significant malaria risk and drug resistant malaria, so forth, complicated itineraries where there may be documentation requirements in traveling where patients could risk not being admitted to the country if they don't have the correct documentation. Those higher risk itineraries really should be handled by people who have specialized training and who are highly confident in navigating that, as well as some of those recommendations around how to manage any sort of infectious disease that may, patients may come back with. So that monitoring afterwards and the ability to ensure that they have access to the diagnostic and treatment options if needed. So that level of travel health service is likely not something that everyone's going to provide. And you don't have to be able to provide that level of service to provide travel health advice, immunization, and some of that care. The big thing here is understanding where your knowledge and skills begin and end, and ensuring that you know how to or when to hand off that patient with the information needed when you recognize that you've gone as far as you can or should go. We talked about that individual intrinsic risk. We think about past medical history, medical conditions, chronic recurring illnesses, surgeries, hospitalizations, any sort of special conditions. So do they have special considerations like, immunosuppression, physical disability, or other factors that require specific travel health planning? Sometimes even, thinking about, oncology treatment, sometimes with certain radiation treatments, patients can actually activate security in some of the screening with being somewhat radioactive themselves. So just those sorts of special patient considerations that they should be aware of prior to travel, even travel with controlled substances and any sort of requirements necessary to be able to cross borders with certain medications. We think of patients being treated with cannabis cannabinoids and their inability to travel with that medication itself. Think about immunization history, of course. Are they fully immunized for routine? Have they had prior travel immunization? What does their documentation look like? Is this also an opportunity to update their vaccine record and not just the vaccines that they've had? And then, of course, the prior travel experience, whether or not they're knowledgeable about the destination, knowledgeable about travel precautions like insect precautions and so forth. Some of the external or trip-related risk would be the timing and length of stay. So when are they going? Are they going during a rainy season, dry season? How long are they staying? How long will they be exposed to those sorts of risks? Are there any itinerary or destination disease risks specifically? So looking at epidemiology within the destination countries, and any requirements, the reason for travel. So, are they visiting friends and relatives? Are they going for work? Is it a special event? Is it just, tourism? Because this can influence the different level of health risks, as well as the travel style and exposures. So, mode of transportation, the accommodations that they're staying in. Are they staying at a five-star resort where there are significant, precautions that are taken to control insects at the accommodation itself? Or are they staying, in a tent in a rainforest somewhere? These sorts of types of things can obviously adjust the risk and some of the recommendations or the strength of recommendation that you make. And then any sort of activities or associated risks. Are they going to altitude? Are they looking at scuba diving? Are they, doing anything that puts them at rabies exposure risk and so forth? So we'll move on to another case as we think about risk stratification. So this is, when our itinerary or patient becomes more complicated. For those of you that know Bill Belichick, I'm from Boston. I'm a big Patriots fan because I grew up watching Patriots football. And Bill Belichick is the notoriously grumpy ex-coach of the New England Patriots, now coaching in college football. And Jordan Hudson is his lovely 24-year-old female partner. And it seems like, with perhaps, this move away from the NFL, Bill has been caught with some of that whimsy, seems a little bit more smiley in some of these photos, not wearing his gray hoodie. But he is a 73-year-old male with a history of coronary artery disease and dyslipidemia. And she's a 24-year-old female with a history of asthma and recent exacerbations. They're looking at a 2-week stay at an upscale resort in the Bahamas. So, thinking about the risk there, obviously some consideration of the destination, in a Caribbean island, but, not staying in a tent in a rainforest. But they do mention that they plan to learn to scuba dive while in destination, and it's unclear whether or not the mermaid tail featured in the picture on the right is going to be part of the scuba diving plans, but they seem very enthralled with the idea of that scuba diving opportunity in the Bahamas. So looking at this, how do we feel about this sort of itinerary? You know, do we feel comfortable perhaps making some recommendations? Do we feel that perhaps, based off of what we've been told, we need to refer this out? When we think about, the individuals, there's going to be some traveling with medications, the opportunity to ensure that they have the supply, discussion around both routine and travel immunizations when we think about some of the recommendations in that area of the world. And then, the activity-based risk here. So some of you may have been scuba diving before in the past or not, but it may actually be worth mentioning that based off of the medication profile, they should check in advance with the scuba diving agency that they're planning on using while they're there, because with heart disease and with asthma, dependent on sort of the health status, those could be conditions that actually preclude them from being able to scuba dive. So that sort of information up front around sort of health status, really important to communicate if you're aware. Once again, it's knowing what you know and what you don't know and the level to which you can help. And it's okay to not know things, but to indicate to patients that they need to be seeking additional support in making those sorts of decisions. Here as well, when we look at even things like talking to patients about travel medical insurance, if there have been dose changes or changes to diagnosed conditions, that can generate medical exclusions within travel health insurance. So at this time of year, very important to make those recommendations around, the seasonal influenza, COVID-19, perhaps RSV recommendations, for these individuals as pertinent to their specific case, especially looking at, the over 65 here, to ensure that any other conditions that they might have are not destabilized, by vaccine preventable disease that could create exclusions within their travel health insurance because they've had to perhaps add on an additional inhaler for the asthma, or increase a dose of medication for another condition. So just some of those considerations where, just even knowing to flag for patients what they should be aware of in order to ensure that they're healthy, can be very valuable. Maybe not necessarily a full travel consultation, but definitely opportunities here for, some funded services, perhaps those medication reviews, so forth, in order to provide them with care that supports travel rather than necessarily being a travel health consultation. If you have the ability and opportunity to do that travel health consultation, which can include things like working with medical directives to prescribe certain things, whether they're vaccines or medications, there's an opportunity here as well too to do a travel consult in addition to more sort of that medication optimization and a travel awareness conversation. And Kathy, I realized before we jumped into the cases, I forgot to do our second poll. So while we're talking about the Bahamas, why don't we throw up our second poll, which is, just for fun here. It's sort of a free form. We're all kind of dreaming about taking some time off, I'm sure, as we stare down the barrel of respiratory season. Where is your next vacation destination? I'm seeking inspiration here. So I want to hear all about the things that you guys are going to be doing that sound pretty awesome. And while you were doing that, I will just go through the next slide just in the interest of time to make sure that we get through everything and we have the opportunity for questions and answers. Yeah, if we can just keep on typing those in, we'll get some inspiration perhaps for all of us on where we can go next. So I've talked a lot about sort of, this opportunity to look at holistic immunization in the context of both travel and upcoming travel, as well as, just ensuring that we're optimally immunized for life here in Ontario or in Canada. So anytime we start talking about immunization, if we're talking about travel specifically, it behooves us to ensure that we're talking about all of the routine vaccines that might be recommended, indicated for the individual we're addressing, as well as if we're having that routine vaccination conversation, definitely worthwhile asking if there are upcoming travel plans and what those would be, and if they need to consider further immunization for that, just to ensure that people have time to do full series of immunizations if there are multiple injections required, boosters, and so forth, to optimize their protection prior to travel. So sort of that, ounce of prevention being worth the pound of cure, ensuring that people have the opportunity to get the service that they need well enough in advance so that they have protection and they're not scrambling at the last moment. So this is our opportunity to, address gaps in adult and childhood immunization. And then, of course, talk about upcoming travel. And with that upcoming expansion to scope of practice, allowing us, hopefully in the near future, to administer more of the publicly funded adult immunizations, it creates much more of a seamless opportunity to bring that all together for many of our patients without having to send them to public health or back to primary care in order to access the funded version. It also creates some of that it updates the list that we can inject, the Schedule 3 of the General Regulations of the Pharmacy Act, because right now in the adult immunization bucket, we don't have the scope of practice to independently inject the tetanus, diphtheria, pertussis vaccine, and that will be amended with, should be amended with this package that comes in, not just changing the programmatic elements of allowing pharmacists to access and administer the publicly funded vaccines and document them in the public health system, but also to consider Tdap as part of the scope of practice and immunization program. And of course, this opportunity with pharmacy technicians to better involve them in travel health by allowing them to do more of the actual technical act of injecting itself. So a real boon for pharmacists providing more of these travel services and immunizations that have injecting technicians, because that opportunity to do the clinical and counseling element and then actually pass over the technical element of doing the immunizations themselves, especially if you're doing multiple at one time, a big time saver and huge opportunity for, better embracing the full scope of practice for all of our professionals. One of the biggest, I think, things that pharmacists, are concerned about when we think about these scope opportunities is, am I actually staying within scope? And does this vaccine especially require a prescription, or can I recommend it, sell it, provide it to someone independently without a prescriber writing it? Because as we all know, currently in Ontario, pharmacists do not have the scope of practice to prescribe vaccine. So we cannot prescribe Schedule 1 vaccines, but we can recommend, sell, and oftentimes administer the Schedule 2 vaccines, so those that do not require a prescription. One of the biggest challenges for people is determining whether or not the product itself, the vaccine itself, is Schedule 1 or Schedule 2. And this is because really vaccine scheduling is primarily determined by a product's inclusion in most or all provinces and territories' routine vaccine programs, or if it's a disease where there's a current outbreak taking place and the vaccine needs to be scheduled to in order to facilitate access to a disease currently in outbreak. Most vaccine products themselves are not actually reviewed for scheduling and are automatically placed into Schedule 1 unless they fall into one of those two categories. And therefore, you can't necessarily go to the national drug schedules and type in, pneumococcal conjugate 20 vaccine and determine whether or not, it spits out Schedule 1 or Schedule 2. This is complicated, it's unclear, and sometimes even different in each province. Currently, OCP doesn't have any sort of additional layer on top of the vaccine scheduling piece. But when we think about something like RSV, whereby, in this context, most provinces don't necessarily have RSV included within their publicly funded program, but pharmacists might be able to administer it as part of the publicly funded program. It makes it even more confusing because for those 75 and up that would be part of our publicly funded program, you wouldn't need a prescription because it would be part of our public program. It'd be Schedule 2 in that context. But for anybody under the age of 75 or not included in those high-risk groups that's paying for it privately, they would require a prescription. It would be Schedule 1, and that prescription wouldn't even just be required for private coverage. So vaccine scheduling, unfortunately, is still very complicated. If you are confused, especially about any of the respiratory vaccines, call the Respiratory Health Line. But ultimately, there are some that are listed within the national drug schedules themselves, but really it sometimes just takes going to the Public Health Agency of Canada website, determining if a vaccine is present within the routine schedules for most provinces. Of course, they don't provide a definition of most. Most could be 50% plus one. It seems to be what it is because HPV, even though there are several provinces that don't include it in their routine schedules, still listed as Schedule 2 because of that connotation that it's part of that routine immunization program in most or all provinces. So in that context, Shingrix is probably one of the ones specifically that has been reviewed as an individual product. That specific vaccine is Schedule 2 because it has been independently reviewed as a product. Herpes zoster as a category is not included in most and therefore is prescription, but the conjugate vaccine is so the non-live vaccine is in fact reviewed independently in Schedule 2, but the live version of the vaccine currently or any other version that wouldn't, that may come in the future would be Schedule 1. This is the worst slide because I think I confuse everybody almost more than I clarify, but I think the biggest thing is just, if you are unsure, if you have the opportunity to receive a prescription, sometimes that's beneficial because additionally to the scope and the scheduling piece, we also have the private plan part to it, where because Ontario pharmacists are not authorized prescribers, there is some variability in terms of plan interpretation as to whether or not a vaccine recommended, a Schedule II vaccine recommended by a pharmacist would qualify for funding and coverage for the patient, even if it's a general benefit and would be paid for if prescribed for by, say, a physician or a nurse who is by scope an authorized provider. So, with this, if a patient does have private coverage, one of the best things that you can do if you are looking at recommending a Schedule II vaccine and they want to use their coverage would be to call the plan in advance of adjudication if you're planning on adjudicating online, and just verifying if the pharmacist as a prescriber is authorized and not, wouldn't be at risk of an audit clawback or just the claim getting rejected outright. And so even if you could recommend it and sell it, you may still require a prescription, even if it's Schedule II for the purpose of coverage. But it's very plan specific. Some plans do authorize pharmacists and recognize pharmacists as prescribers, even though we don't technically have the scope because of this differentiation between Schedule I and Schedule II vaccines. So lots of layers of complexity there. I don't want that to discourage you, but it's just important to be aware of, especially given that many of these antigens are on the more expensive side, and that coverage piece can be really important for that relationship with the patient and whether or not how to navigate the best route to access for them. This is also really important too when we go back to the scheduling that and thinking about the Schedule III of the Pharmacy Act with our ability to inject. New antigens that come to market often need to be added to the list in Schedule III in the regulations for us to be administering them. Great example of this would be, for example, the new chikungunya vaccine that has come to market and available in Canada. It is not on our list of travel vaccines in Schedule III and has not yet been added in the regulatory package and updated. So we would need an actual direct order or medical directive from someone authorized to administer all vaccines in order to inject that vaccine. So, as we see new products, new therapeutic areas coming to market, just important to ensure that we're aware whether or not we need some sort of additional authority to inject, because we don't have open injection authority for travel vaccines. We have a specific list. So our final case, we have, of course, America's royalty couple, Taylor Swift and Travis Kelce, 35-year-old couple that are recently engaged, no significant medical history. Beautiful engagement. They're planning a beautiful, ultimate multi-continent honeymoon itinerary after their wedding. They're going to spend, got happy there, 2 weeks exploring the Amazon rainforest from Manaus, Brazil. And then they're following that up with a luxury safari in Kenya's Masai Mara area. So with this itinerary, I think automatically we kind of look at this and go, even though these individuals might be low-risk travelers based off of their extensive vaccination history, their health status, athletes, celebrities, otherwise healthy, we know extensively vaccinated, which is a great starting point. There may be new vaccines that are available to them to help keep them safe on this sort of itinerary. And as well, there's going to be other considerations such as malaria protection. And with going from a yellow fever risk area like Brazil, Kenya is going to require them to show proof of yellow fever vaccination before entry. For those who are aware of the yellow fever requirements on that yellow card, you will probably know that there was I suppose it's not recent any longer, but there had been a change internationally to recognize yellow fever vaccination as a lifelong vaccine rather than conferring the 10 years protection, and a change to that where if you have a yellow fever immunization certificate that is older than 10 years, it is now considered valid for international travel rather than needing to be updated every 10 years. So that's just, a recent update to be aware of. though some people may not have kept that immunization status card. So that can be reissued in the instance where those medical records were maintained and patients can demonstrate that they've been immunized. So in this case, when we think about this, the high-risk honeymoon, the need for yellow fever, this is probably something where you can start with some of, the general recommendations, some of the things that you can help with, ensuring that they have some of the products they might need for things like insect protection. But likely, unless you're a yellow fever center yourself, things like this are going to flag you to refer that and help them find the level of care that they need. So one of the biggest things that we've talked about is recognizing where your knowledge starts and ends, and the fact that knowledge, in this knowledge base specifically, as we deal in infectious disease, is constantly changing. And really important to ensure that you're able to stay current. And that doesn't necessarily mean that you have all the current information stored in your mind. If you're not doing this every day or very currently, and consistently, knowing everything that's changed is just not possible, especially in this highly specialized area. So just ensuring that and have bookmarked, and if you are providing sort of within your practice site, that resource destination library that you provide to your staff, to your team, to the other people providing this sort of information on where to find the most updated information. So of course, Canadian travel health resources will always be your gold standard practicing in Canada. So the CATMAT guidelines and your PHAC information are going to be your gold standard, your first destination. With some of the Canadian travel health resources, sometimes you're not able to find as many of things like, the destination specific maps around, insect related conditions like malaria, yellow fever. So even though it's based out of the CDC, which we know is currently in flux right now with some of the changes going on in the United States, the CDC Yellow Book is still published online, still accessible, and still current with the required science, has great maps, interactive resources on the CDC Yellow Book, but just sort of asterisking that dependent on HHS continuing to provide information related to vaccination and international health, that ensuring that you have access to other resources available to if that happened to not be available for a period of time. World Health Organization is a great opportunity. ISTM membership, if you are providing more of those travel services, it's a great resource, a lot of education, listservs and what have you to keep you update. You may choose to do your certificate in travel health, you may not. I found it a very worthwhile certification, and the body of knowledge is quite extensive. But that really does focus you on providing more of that, higher level of care, whether it's the medium risk destinations, itineraries and patients, or even the high risk if you happen to be able to be certified as something like a yellow fever center. Journals and databases, there are plenty out there, as well as sort of software subscriptions that will allow you to put in destinations and get a lot of great information around the risks and recommendations. And of course, new vaccine product monographs and guidance that comes out as we look at the landscape, where there's a lot of innovation in the vaccine pipeline right now, and new opportunities to protect our patients by putting new tools in our toolbox. So the biggest thing is, where you start to become uncomfortable with whether or not you're able to fully address the patient's health status or itinerary. Knowing when at that point in time to be able to pass off the patient and do so in a way that empowers them to get the information and leaves them feeling good about the interaction. And just being prepared on how to do that with whatever resources are present within your community. Oh, going back instead of forward. I'm losing the plot on my slide navigation here. And then finally, as we think about sort of, how do you actually do this in your pharmacy? I think the biggest thing is that you don't need to be starting with a full-fledged travel clinic, with protected time for full consultations to be able to provide travel-related services. Everyone can do this. We do some of it already within our practice, and I think it's more just about thinking very thoughtfully within your practice, where are those opportunities to embed some of this in a more standardized way? So I would recommend looking at something like a stepwise adoption. So first starting with those low-hanging fruit travel consultations. Maybe it's just part of a medication review and it's about some of those over-the-counter products and just making sure that people have like their medications properly labeled for when they travel, or that they have enough, or that they know how to access healthcare when they're going away. So starting slow and then being able to build. Okay, what would be the next step that's natural to my practice and to my knowledge? Do I need more training? Do I need to start look at protecting some time? Do I need to consider what I would charge for this sort of service, because it's going beyond just providing more holistic health advice, and now it's a specific service itself? Do I need, if I'm really enjoying this, is it worthwhile looking at creating a collaborative practice opportunity, perhaps with a prescriber, where there could be medical directives in place that would allow you to do some of that prescribing and other administration independently under that directive. Of course, always looking at what sort of training, resources, tools we're providing to ourselves and to our teams, and ensuring that people know where and how to access those. If you've got a subscription to software, that everybody has access to that, you have the right level of subscription, and that you're looking at some of the Canadian resources first, they're relevant and that they're up to date. And then with any sort of program, obviously, as you're monitoring it and doing that quality assurance and having feedback loops, how is this going? How are people receiving it? Is there ROI for our pharmacy business? Because of course, as we think about moving to this more service first sort of environment in pharmacy, there needs to be funding in place to support it, to be able to pay our people to support that. Obviously, there's revenue opportunity on the product side when it comes to the provision, dispensing of prescription medications, vaccines, as well as the OTC side of things. Great front shop opportunity. But on the service side, of course, there needs to be that business case and justification, as well as the assurance that people are getting the quality of service that they need. And with this sort of implementation roadmap, as we sort of take a stepwise approach, there's the opportunity, of course, to grow it, but it's also okay to integrate some of this and stop there where it feels comfortable and reasonable for the business, and then reassess that opportunity for growth at a later time. So I think the biggest thing here is that, if we think about it in the context of expanding scope and talking about pharmacies as vaccination destination, travel fits in very naturally here. But there is some of that additional, training and preparation that's needed in order to properly operationalize a service like this. So in terms of our key points, a lot of travel happening. It's booming. People are doing really interesting things, but things have changed. So stay up to date, know your limits, and really, where it comes down is, what are some of those organic opportunities that we have within our pharmacy, within our interactions with patients on the day-to-day basis, to ask a couple additional questions, to be able to bring this sort of holistic approach to preventative health and health promotion into our practice, which really marries the opportunity for routine and travel immunization in an opportunistic way. And I will say, from practicing travel medicine quite extensively under medical directive, being a yellow fever center, it can be a really rewarding part of your practice and business. And the conversations that you have with people that are often, very excited about what they're doing, can be a real high point within your day. So it can be a lot of fun. But the key is just to look at ways that you can integrate it in a way that's sustainable, so that you can build it over time. And with that, I'll leave it on our key points slide, but that's the end of the formal presentation. And
Jen, I
yeah,
was going
Kat,
to also share the
let's share.
results. Ending on a
Perfect.
positive note, there's a lot of people who are looking forward to vacationing somewhere, and I think you should be able to see it. Can you see it?
I just
I
see that
don't
I didn't answer
see
it
anything.
because I don't think I was allowed to, but I don't know
Oh,
if that's the aggregate
hmm.
here.
Let me Okay, I can let me share my screen because I can open it on a separate screen. It's kind of odd, this
Yeah.
feature. I can open it on a separate screen.
While you're doing that, I'll maybe address some of the questions while you're bringing that up. So the certification program that I took, so I did the International Society of Travel Medicine Certificate in Travel Health, so the CTH designation. In that they offer a lot of preparatory materials, and ISTM themselves offers a prep course. So I went and did that live in person and found it extraordinarily valuable. And then prepared using the list of resources that they provided. So I did that just about a decade ago, and really informative course. So it's the International Society of Travel Medicine. And then there was a question asking if should we recommend teeters on first on prior vaccinated individuals? And so that will really sort of depend on the situation. In pretty much all cases, if a patient isn't able to fully recall, they don't have a record of vaccination, it is possible to do teeters, but once again, not within our scope of practice to order lab values. And it would just be, a clinical decision as to whether or not just proceeding with re-immunization versus actually doing the blood work to look for immune response is there, or if there's an indication that someone might be under responding to vaccine, or have some of that lost immunity, they aren't entirely sure. There's an opportunity to do that as well too, but it really comes down to that clinical decision making on the disease itself, the vaccination opportunity, and the risks benefits of doing that. So very sort of individualized piece, but just remembering that you would either need a medical directive or another practitioner involved when ordering blood work for that. And in the vast majority of cases, reimmunization, if unsure, is entirely safe. And then there was just a question: is the yellow fever requirement because they're going to Kenya from Brazil? And yes, some of these countries will have entry requirements where if you're traveling from a high risk country, that you need to show proof of vaccination, not because the disease is necessarily endemic in the country that you're going to, but typically because they have the type of mosquito that can transmit yellow fever and they're looking to control within the country itself. So that's the requirement. It's not, necessarily the risk in Kenya. It's the entry requirement because traveling from Brazil first. And this can be particularly impactful on cruise itineraries. So something to watch out for, even if people are just like, oh, we're just going on a cruise. If they're planning on getting off in destination, that consideration, because there are even some, the Trinidad Tobago, yellow fever destinations, some cruises, even Caribbean touch on like the coast of South America. So itinerary specific pieces often, cruises will advise those sorts of things, but definitely worthwhile reviewing in the context of those multi-destination trips. All right. If there's any, so we can't order yellow fever vaccine currently in community pharmacy, only yellow fever centers. And yes, that is correct. It is not available. Generally, it's also not, at the time where I was yellow fever, not available through wholesalers. You have to go direct through the manufacturer, and you need to be authorized by the Public Health Agency of Canada, with a medical director who has it within scope to prescribe and administer yellow fever. So it's an application process. You need to be designated, and only those that are designated can order. So that is correct. And with that, I think we're at 1 o'clock. So thank you everyone so much for taking the time to join us. Thank you to Valneva for your generous sponsorship of this educational opportunity.
Thank you so much, and thank you, Jen. That was a great presentation. Loved the cases. Take care, everybody.
Thank you.